Hello, I'm Darren. We have breaking news. More than 600,000 Americans have kidney failure. While the number of people with kidney failure is enormous, the number of people with its precursor, chronic kidney disease, is staggering. An estimated 31 million Americans, or about 10% of the US population. Diabetes and hypertension cause 2/3 of all cases of kidney disease. 1 out of every 3 Americans is at risk for kidney disease, and kidney disease is now among the top 10 causes of death in the United States. In addition, 9 out of 10 people with early to moderate kidney disease don't know they have it, putting their health in jeopardy. Are you at risk? For more information, contact urbankidneyalliance.org. The life you save may be yours.
Good evening. Welcome to Mental Health and Me. I'm Steve Belcher.
And I'm Sade Cutler.
Hey, what's going on, Sade? How you doing?
Nothing much. Hi, Steve. How are you?
Pretty good, pretty good. I had to ask my man Jared to make that a little longer because I was thinking that intro was a little longer than it was.
Oh, really?
Yeah. It caught me off surprise. I ain't going to lie.
It's nice, though. But
Yeah. So
it's way shorter than the other one.
Huh?
I said, yeah, it is shorter than the other one.
Right. So how's your week been?
It's been pretty hectic. But no complaints. No complaints.
Yeah. What you hearing? About this post-election? You hearing anything about any mental issues going on?
Of course, a lot of people are like, basically having to log off because it's just too much for them. And then, with the additional stuff with the COVID coming back, with the spikes and the lockdown and stuff coming back, on a lot of anxiety and depression is coming from all of it. People just want it to be over. They just want it to be over, but it's not yet.
Right. Wow. Well, I'm supposed to be going to Atlanta next Monday, till Friday. So once, hopefully I can get that in and then, don't be caught in a lockdown.
Oh, okay. All right.
Yeah. I'm going to visit a buddy of mine and just kind of take a little break from DC for a minute.
Yeah, you need to get out.
Yeah, absolutely.
Relaxation.
I'm used to traveling. Not all the time, but just going to different cities and trying to meet different kidney warriors and see how dialysis is and how many clinics there are in other states, far as in real time.
That makes sense.
Yeah.
Like traveling is therapeutic for a lot of people. Like that's what they do for like their hobby and things like that. So with it being put on hold or just having the fear of everything that's going on with the virus and everything is just anxiety provoking in itself. But I hope that you have a good time.
No, thank you. I appreciate that. So tonight we got a great show. Whoever's watching, the 5 people watching, share this broadcast. It should be more people watching. Especially a mental health show that normally doesn't come on a regular. You may have certain institutions, Sade, that may have a webinar on mental health, but there's nothing consistent like we've been doing, I guess, for the last month and a half, I believe, maybe almost 2 months.
That has been long already? Yes.
Yeah, I gotta look back, but every Wednesday at 7 o'clock, consistency, talking about mental health, and just so happily we've been discussing anxiety and depression. So I mean, share this broadcast, guys, because you're not going to get this anywhere else. But tonight we have a guest. She's making her rounds. After she's on this show tonight, she's going to be on Warriors Quest as a co-host with Jared A. Brown. So I don't want to keep her on here too long, but we have Dawn Kurkowski, who is a licensed social worker and also a 20-year kidney recipient. And so I'm sure, Sade, everything we talked about over the last maybe 3 to 4 weeks about anxiety and depression, I'm sure she may have experienced something out of that. So it would be great to hear from her perspective. Now being a social worker for, I believe she said 13 years, 14.
Yeah.
And so at one time she wasn't. She probably was on dialysis or had that experience without being a social worker. And then she goes through the experience of being a social worker and applying it to her life. So let me ask you, I'm sure that's very therapeutic for someone who may have went through the process of receiving a transplant and then wanting to give back in so many ways, because maybe they seen the flaws that they may have experienced through that journey. Can that be therapeutic?
Yes, like sometimes when you're going through something, you realize the things that area needs, or you look at the benefits that you could bring to it because you're going through it. So definitely for her to have challenges with kidney issues, to go on to have a transplant, she probably saw both sides of it. She probably saw good sides where she met people that were excellent and treated her well, and then the other side of it on those areas that she would want to change. And by her becoming a social worker, it's like now you really can be effective in change. You can go into different areas to counsel people, to help them with transplant, to help them with dialysis if she wanted to go in that area. So becoming a social worker and experiencing kidney disease and getting a transplant is like major. She can help you from beginning to end.
And she could pretty much kind of carve out a niche for herself.
Absolutely. Because people sometimes want to talk to people that have experienced it, that been through it. Not to say that other people wouldn't be able to be empathetic or understand. It's just something about it when you have someone that knows what it's like to go through the struggle. And then she's on the other side of it where she can therapeutically help you and give back too.
Right, absolutely. So we got the suicide hotline going through, not to say that anybody's suicidal, but by this being a mental health show, we just want to do due diligence and being responsible and having a number just in case, because you never know who may see this show, post show, and could be in that position where, they could be lost. So share this broadcast, guys. So without further ado, I'm going to bring on Dawn Kurkowski. Of course, she has to get the VIP intro. So let me do that now. Hey, Dawn, how you doing?
Great, Steve. How are you?
All right, hold on for 1 second. Let me change this around. Wait a minute, doing something wrong. Hold on. There we go. Good. So how's it going, Dawn?
Great, great. Very stressful at my job right now with all the with COVID. I see back to back to back people for um, anxiety, depression, and I also help treat schizophrenia and bipolar disorder. And I found that the way that the atmosphere is, both politically and with the COVID, it's exacerbated and increased symptoms like
Yes.
3 million fold. It's
Yes.
really hard.
Wow. Now, Don, let me ask you, are you seeing these people virtually or face to face?
Right now, it's all virtual. Yeah.
Mm-hmm.
People say they miss face to face. I actually miss the face to face with my clients. There's a much better connection when you can see them, and really, see their body language and get a sense of them, and vice versa. But we're
Mm-hmm.
we're, we're coping. It's hard to do on screen. It's very tiring. But
Uh-huh.
we're doing it. They're just glad we're open. I want to shout out to anybody who may be from my agency, from the agency I work for, CBH Care, or people who may watch it after. CBH Care in New Jersey, a very large mental health agency, and I've been there for about 12 of 13 years.
Wow.
Wow.
Wow. Damn. So, Don, let me ask you, from a patient perspective and a social worker perspective. So, like right now,
Mhm.
there's 8 people watching. I don't know, as far as watch parties going on, anything like that. But do you think that that's a low amount of people watching a show like this, where mental health is a big issue now? I mean, and especially now, like right now, we have 2 clinical social workers
Right?
on deck. I mean, 2 clinical social workers that's licensed and
People
professional.
should see it.
And you would think that, kidney disease affect many people, that we would have more people on here than this. Do you find that surprising as a practitioner and as a transplant patient?
Yes, but I also think even though people are not face to face socializing, they may be doing other things, being it's Veterans Day and not really thinking about it. Like I saw your post earlier that it's Veterans Day and people are still suffering from kidney disease. I think people don't sometimes want to think about it, but
I
more
can
people should be
understand
watching.
that.
But people should be watching it. Really, people should be watching, should be sharing. Please share. I mean, the world needs us to talk about mental health, and the world needs us to talk about kidney disease.
Right. Absolutely. Absolutely. I totally agree.
What do you think, Sade? I mean, especially when it comes to anxiety and depression with, someone who may be experiencing not just kidney disease, but other multiple issues along with the kidney disease. And if they were really involved heavily in the election, maybe their candidate did or didn't win. I mean, how important is just a place where you could maybe decompress or talk about what's going on, such as a show like this?
This is good because it gives people an opportunity to be able to express themselves on both sides and remain totally objective as we speak about certain things. I feel like right now I've had people already reaching out to me for therapy because of the election. There were some people that were conservatives, there were some people that were liberals, and there were some people that were Democrats. We all have our own reasons and beliefs as to why we wanted certain people to believe. I think that the attacks that have happened on other
Oh yeah.
people has been traumatic for a lot of people. People have lost their friends, their family from this election stuff. So it goes a lot deeper than just the presidential election. Like families have really become totally disconnected, and it's based off of views. Like
Bad.
people are associating a party with being racist, period, even if you like a party for a specific reason. And when you start to do that, people don't realize the other traumas that come along with it. Some people have picked a candidate over another candidate because they believe it lines more up to the way they live. And it doesn't have anything to necessarily do with not liking a race or not liking a gender or not liking this. It's just because of what they believe is right for them. They wouldn't impose on that person. They wouldn't discriminate on that person. They wouldn't hurt that person. They just believe in their heart that this is the way that they want to live, and these are the rules that they
Okay, there we go.
Right.
Mhm.
So I think that a lot of people right now are getting caught up into the media and the hype of things, but a lot of things are happening behind the scenes. There are people, parents that aren't speaking to their children for certain things, for like weddings, households being divided because mom might think one way and the children are thinking different ways. I mean, it's just so much division. Biracial couples have come in with me because they have a view of something and another person might have a different view. So it's been a lot of other issues that have come up from the election stuff.
Dawn, what have you seen in your practice? But not just your practice, Dawn, you're involved in multiple Facebook groups, and I'm sure you're seeing a lot of hatred when it comes to these candidates and some of the vicious posts people been writing. I don't want to be honest. I mean, and I'm atoning for my wrongs in posting Donald Trump posts or memes and stuff like that.
I seen them.
Not right. I don't wish any ill will on anyone. So I've decided to stop posting those memes. But sometimes I'm just human, and it automatically comes as if I see something. But I'm damn sure trying my best to stop doing that and just focus on the task at hand, which is kidney disease. But Dawn, being a kidney patient and a social worker, I mean, have you seen the vile and just the nastiness and the division these Facebook groups?
The ones I belong to, most of them will have rules stating that they're not allowed to do that. But once in a while, something will pop up. I've had a couple. I have 2 Facebook groups, Transplant Experiences and Living Well with Chronic Illness. And once in a while, somebody will post something. I will usually just remove the post. I will try very hard not to say anything because I don't want to increase the argument. Once in a while, being human, I've said something to a couple of people, but it was along the lines of, can't we all just get along? I've seen families torn apart. I think in relation to kidney disease, if families aren't talking to each other for political reasons and people need that support if they're a kidney patient, that makes it even harder for us kidney warriors to get support.
Yes.
Wow. Is it to that point where a something as such as a presidential candidate will come over someone else's health if they're family?
They could if they're not talking to each other. I think it like a lot of families have stopped talking to each other as a result of, oh, you like Biden, you like Trump. And so now when a person needs help and somebody's not talking to them, and that happens with other stuff too. I mean, whenever families split and they're not talking, there goes the support network.
That's true. That's true. Because you'll have people like, I'm not taking you to your treatment. I don't want to be around you. Find the Uber. Do that the best way you can. And it sounds harsh, but it's real.
It's real. It's real. And my job, I see that all the time. I mean, some people not over the election, but I also work with the homeless. And I have had homeless people, where their families just pretty much disown them. I've even had a few that were dialysis patients. Can't understand that one. I mean,
so Sade, now that the election is over, everything's been said and done. People done kind of seen people for who they are over a political process like this. How do we move forward to the road to recovery? What does that look like from your opinion?
Steve, the craziest is some people don't feel like it's over yet. People are rooting for Trump to get a recount. So technically, with it being like the president-elect, they've announced it for like the media and stuff like that, but they're saying that it's like he has some, I think, legal proceedings going on. So there are
Yeah,
people
he does.
holding on. Yeah, that people are still holding on. So it's still kind of like limbo right now. It's still limbo. You have people like it's not done yet. They called it, but they don't have the right to call it. There are a lot of whistleblowers going on about the election and stuff. So it's a lot going on right now. Although they have said it, like the media is announcing it, I think that there still are a lot of people that aren't they aren't sold on it yet. So that healing process can come when people start to just agree to disagree. If you just agree to disagree at this point in time, you'll be a lot better off because we don't really absolutely know what's going to happen with any of this. And it will help a lot of families start to be able to move forward in the right direction. But a lot of people are angry right now. This was a really, 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 really nasty presidential fight. Like this was rough. And a lot of people have totally became invested in it. A lot of issues that are on the line, people are strong about it. Like they're really strong about it. So, I mean, one of the things about recovery is to actively be ready to do it. Some people aren't ready, they still stuck. So, when you're still stuck, it's a process in that part too to get you to the point where you're like, okay, I'm ready to move forward with this no matter what happens. And some people just aren't ready yet.
So Don, let me ask you, since this show is called The Road to Recovery from Anxiety and Depression, as a social worker and as a patient, how do you deal with that? Do you use your own advice that you give to other kidney warriors, or do you have someone that you see that helps you deal with maybe some anxiety or depression that you may experience in this process?
Well, strangely, helping others actually helps me to deal with my own anxiety of what's going on out there, as well as being there for my mom, who I've told you is very sick and is in a nursing home. Sometimes I don't feel like I have time to deal with my own anxieties. So, but I do actually use a lot of the things that I tell my clients, and sometimes they give me good ideas. So, plus the other thing is I feel like I don't want to be a hypocrite. So when I teach things like breathing exercises, well, then I either go home and try them or I do them with the clients right on screen. And then we both benefit, it seems. So it's kind of take and give. I do a lot of the things I tell them to do. I can't not do it as a kidney patient. Self-care, when I teach self-care, I remember to care for myself. It reminds me as a kidney patient that if I don't keep this kidney, if I don't keep going, I won't be able to do this job to help others. So it's kind of both. I mean, I think about being a kidney patient at work all the time, and this is why I'm doing what I'm doing. So it gives me a different perspective than a lot of the other social workers who fall into the care for others and not yourself trap. Shada, you might know what I'm talking about.
I'm familiar.
Yeah, that's social worker talk.
Yeah. Hey, nurses do it too, though. I've talked to nurses who, don't get a lunch break. I have a few I'm giving therapy to because they lost their self-care and all this COVID stuff.
Yeah.
Nurses are guilty too.
Yeah. Now, you mentioned one thing that's on this list to Road to Recovery. And it's two things. One is learn to relax, and the other one that you mentioned, breathing. This one is better breathing. And this says take slow breath in for 5 seconds, hold it for another 5, and then breathe out slowly. Don't rush the breaths, and repeat for a minute or so. Repeat this exercise twice a day. This will help you to relax your mind and body. Now, is this true?
Yes, but I add something to that. I like
Tell us.
Yeah, I like visualization exercises, and I like to do them with breathing. In fact, one of the shows you had on with somebody, and I apologize that I don't remember her name. There was something.
Tanya.
Yeah, it reminds me.
Yeah, she used to be on here, dietitian. She's not a dietitian. I take that back, but She was a health wellness coach. That's right. And she had kidney disease. She still do in a GFR, something like 17%.
Yeah. Anyway, so when I was watching it, I was thinking about something, and I came up with a little exercise where, as you're taking the deep breaths in, close your eyes and visualize like you're basically breathing in white energy, or you're breathing in good energy, and as you breathe out very slowly, you're letting the stress go out of your body as if it's some kind of darkness or a cloud. You're just releasing it back into the air and breathing in positive energy and breathing out negative energy. I've used the visions describing it as either smoke or clouds or however you see it. For some reason, some people, they feel like it's very spiritual, and they may say, I'm breathing in God's energy and I'm letting out the dark energy. However a person wants to visualize it, I use. And it tends to help when they close their eyes and visualize something as they're breathing. And I let them know that if the anxiety comes, to let it go. Don't try to stop it. If you stop it, it's harder. It sticks around longer.
Now, Sade, let me ask you, learning to relax. How can one, if someone has a chronic disease and they're going to multiple appointments, they find themselves always in the emergency room or something like that. They're going to dialysis 3 times a week, and then they got to deal with just life in general. And they may have a family, or they may be single with kids. How can someone learn to relax with the plate that full?
Sometimes our life is just busy, and those are just commitments that we have to have. We have to complete certain things, like you have to go to your dialysis treatment. You may have to work. There are certain things that you won't be able to change. So when you want to relax, you may have to try to implement a time where you will say, this is what I will do to relax my nerve, whether it's an hour of watching TV, a walk, just to lay down for a second in complete quiet, to meditate, to listen to some music, to pray. Like, you find what relaxes you and you try to put it into your schedule, because sometimes in our brain we can remember what we did that make us feel good and know that we did take that opportunity to do some things. So that would help. Like, even if you like crocheting or online shopping, things like that, you just try to put like a time slot in your day to help you. Some things won't change drastically, but that's like a step in the right direction when you try to implement it. Just like at work, you might be tired at work, but we just talked about that with Dawn. Like, you should take your break. That's a part of self-care, just to take a moment. It's not all day every day, but it's just a piece. It's a piece of the
Could I add to something Sade just said?
Yes, sure.
What I tell clients is, they're stressed by all of the extra things, and a lot of them do have chronic illness as well. So I tell them to literally write their name in their schedule, because they say, I need to make time. No, you can't make time. There's 24 hours in a day. So especially people who also work, or they got childcare or whatever. So when you're listing and you're writing 3 o'clock, I got dialysis, and 2 o'clock, I got to bring my kid to childcare or whatever, you put your name literally in your schedule, on your phone or in your date book or on your calendar. You got to date with yourself. I don't care if it's 15 minutes or 30 minutes, but you got to do it.
We can't hear you, Steve.
I'm sorry, I had muted myself. I said, that's a great idea.
Yes. It's important. You know what else too? A lot of times I tell people, like, you need to bring in other outside resources to help you too as well. Some people are totally against that. I am all for it. Like, getting you a good nanny if you have a baby, to help you while you're home. Like, it's okay. Even if you have to get them for a few hours just so you can get a peace of mind, you can get a nanny. Cleaning people. I've had cleaning people come to help me because I'm so busy, and then it's a stressor when I'm not able to clean the way I want to clean or get to things because my schedule is so booked. I'll just get people to come in and clean with me. And you will, it takes it is such a stress reliever. Like it
Oh,
helps
yeah.
so much.
So, Sade, let me ask you something that just came to mind. So, we're talking about the road to recovery with anxiety and depression. Now, what happens when recently there's been the initiation of new restrictions, and there's talk of looming another lockdown? The UK, the United Kingdom, has already started their lockdown, and we're hearing, I don't watch the news, but I'm just hearing talk of a pending lockdown here. Now, with that being said, I mean, you had people out used to having freedom from a previous lockdown back in March, April, and during those months. Now we're talking about going back into that. COVID it seems like it's coming up to an all-time high. I mean, are we just like going backwards with the mental health? How do we keep it going to let people know that, hey, you did it before, it was rough, now you got to pretty much do it again? How do you get through this one that could be much worse? You know, people died, a lot of deaths. I mean, what we do? I mean, I don't know. I'm kind of tongue tied.
If people could come and watch the show like this to get the information, to know how to prepare and know what's ahead, that would be a preventative measure into helping it. It's not saying that it will stop it, because it's going to happen. The spikes are already there. They already are projecting. First of all, it's seasonal depression is here too. The holidays
Oh,
are
yeah.
coming. So people start to grieve a lot around the holidays. People
Mhm.
aren't able to be with their family. People are missing the family that has passed away, that are lost. A lot of families aren't talking because, like, the election
Mhm.
stuff. So now, with it being a lockdown, there is going to be a spike in mental health issues. That's just hands down. We know that as clinicians. Like, that's what it
Yes.
is. Yes. There also has been a study and following people that have been diagnosed with COVID. So that's another area of mental health that's going to be a spike, because a lot more people are going to be diagnosed. They like the projections were high. Just the fact that they were diagnosed with it alone has caused depression and anxiety, because the
Mhm.
aftermath of the medical effects that they're having on it is stressful. I've just had different people talking about the stress because they still can't taste or smell, and it's going to be like that for months. So they're not enjoying the food and they feel depressed about that. It's a
Mhm.
domino effect that's going to happen. So
Everything.
yes, like right now, this is an expectation. Like, I already started preparing my clients now. It's a spike coming. Like, it's going to be a big spike. We know that. We know.
Right. Now, Don, from your perspective, what are you telling renal patients? I mean, you're on both sides of the fence, being a transplant recipient and a social worker. So, uh, uh, what are you doing to prepare for yourself and to help prepare your clients? And also, has anybody reached out to you from the social media world, like the kidney community on on Facebook, to kind of help coach them or guide them through this second wave of lockdown that's pending?
Well, basically, as far as other people in the social media, I'm offering help wherever I can and listening to people's stories, even people I don't know. I'll friend them or have them friend me, or just talk to them. Sometimes I'll just message people. I think what we need to do out there in social media is just check on each other.
Yeah.
A lot of times people are afraid to reach out to you. I think it's important to, check on each other. As far as myself, I'm doing what I keep on doing: wear the mask, wash the hands, stay out of large crowds, especially important for kidney patients. Basically, if I see somebody not wearing a mask, my husband and I both like walk the other way. Don't shop during busy times. all of those type of things. It's very hard when I go to work, but I'm pretty isolated in my own office where I shut the door all day. That's a little lonely and isolating. So occasionally I have to talk to a coworker. So that gets very anxiety provoking, and it's kind of hard to be by yourself all day with the door shut. But I do it because it saves my health. So that's kind of hard. Preparing the clients. I like something Steve said earlier about you got through this before, you can get through this again. For me, that's how I see things as a kidney patient and as well as a social worker. I tell myself when I'm having a hard day at work, because it is very intense right now with all the people seeking treatment. Look, you got through kidney disease, you got through dialysis, you got through transplant. So, you can get through a bad day at work. You can get through this COVID crisis too. I constantly remind myself that bad day is much different than this bad day. And I use that with my clients too, especially people who suffer chronic illness. And, I say, hey, look, you were just hospitalized and you got through that. So look, you know what? You got to use that strength that you have to get through this. You just don't see it right now.
Mm-hmm. Now, Sade, on this paper, The Road to Recovery, it talks about enjoying healthy food and drink. And it says having CKD involves limits on food and drink that can be very frustrating. In addition, depression, anxiety, and kidney disease can all lead to a lack of appetite or even craving for things that are not good for us. Paying attention to your diet can make you feel physically and mentally better. A hungry or malnourished person will feel irritable, angry, moody, tired, weak, and lacking in motivation. Your doctor may want you to see a renal dietitian who has special training in diet and CKD. And then it says our physical and mental health interacts continually. Getting enough sleep, eating healthy meals, and avoiding recreational drugs and excessive alcohol not only does your body good, but will make you feel good too. Too much caffeine can contribute to feeling anxious, so try reducing or even giving up coffee or other drinks that contain caffeine, such as cola. Try not to drink too much alcohol to make yourself feel better. It can actually make anxiety and depression worse and will also not be good for your physical health. But with all that read and being said, again, the pending lockdown, and if that's so, if someone with CKD is already having appetite issues and now they're locked down and their anxiety is high because they may be watching the news and they think if they go out, of course they're going to be at risk, but how can that affect mental health? Because if you can't get out to get healthy food and you're locked in and you're stuck with eating maybe processed food or food that's not even good for you, like processed food is high in sodium, so it's going to make the person drink, and then they're not going to feel right, then they're already depressed. Where does the mental health come in this?
I think that you just try to strive and do the best that you can with what you have. The truth is we live there. There are some places that do have food deserts. Like they call them that. And you do a lot of work with saying the proximity of the dialysis facilities and the fast food restaurants are like right there. So with that being said, sometimes people don't have any access to anything else, and some people don't really know about nutrition. Like a lot of people eat things and they be like, I never knew that this had the effect on it. Like they might believe that fast food might make them overweight, but they never would think that it would affect their kidneys. Or they might think that sweets is directly affects or causes diabetes, but they never thought that processed foods like Burger King or different things like that will cause diabetes. So a lot of times people are just not aware of certain things or how certain things affect them, or even with the sizes. Like people are so used to eating bigger portions now. Even myself. that you don't even sometimes you just don't pay attention to those things. So I think one of the things that the COVID pandemic can do while you are home is try to be more aware, to at least try to get those things in order, try to manage the portion sizes and things like that, to start somewhere.
Mm-hmm. Now, Dawn, let me just ask you something, and then add to what Sade said. But let me ask you, Dawn, being a kidney recipient and a social worker, and with this pending lockdown, possibly, or maybe it already started in some states, I'm not sure. How important is a show like this for people, for kidney warriors, during this time?
I'd say it's very, very, very important. I just want to mention one of the shows you have. The Kidney Cookery is somewhere people can seek to find out very healthy recipes, and they can also contact Chef Oliver Hale, and he'll send you a recipe. He's fabulous. He sent me one for whatever
awesome.
you have. So I just want to shout out to that. So you need shows like this to help educate you about both mental health, and a lot of the shows talk about diet and what you should or shouldn't be eating. But I think people should also consider, if they're not eating or they're eating unhealthy food, to seek mental health treatment, because sometimes we eat badly for emotional reasons. I have a lot of clients that do that, and then I have to speak to them about how it causes high blood pressure and diabetes, which I can speak to that being a kidney patient. And being a renal patient actually helps me to be able to explain things, but have more empathy for what's going on when they're overeating. So it actually helps me to explain things to them because I know what I'm talking about.
Yes.
Wow.
And I try not to beat up on the patients about that too, because some days I had patients come in and they might be overweight with the fluid and things like that. And we just have a talk, and they'll be like, Miss Sade, my family cooked out and I just wanted to feel normal. And I ate a few burgers, I drank a few more drinks than usual. And it's not my norm, but I just wanted to enjoy the time with my family. And the American way is, a lot of times we eat, like we go out and we eat. So even for people that aren't struggling with kidney disease, the habit is there. Like when you go out with your family, y'all come together, most of the time it's over food. So we associate that with so many different things. So just because you have a chronic illness doesn't mean that you'll take the normal parts of life that society has there. Just because you have it. Sometimes you slip ups. And you don't want to be bashed for it. You know the importance of it. You know how you are supposed to be on track. You know that you're supposed to eat a certain way. But every now and then you just have a moment. You have a moment.
Having a treat, having a moment is not horrible. It's the chronic bad eating that is. But you got to take the clients from where they're at. You got to, when a person's talked to you, like, where are you at with that? What are you doing? What do you know about diet? Ask them some questions about how they're feeling and what they're actually doing right, and acknowledge what they're doing right. You got to acknowledge other people what they're doing right, because otherwise they feel beat up upon.
Yes, absolutely.
Now, Dawn, let me ask you. And I slipped my mind for a moment. When you oh man, I lost the train of thought that I wanted to ask you, but let me move on to this. How should a person tackle going through suicidal thoughts if they are on dialysis and they get to a point where they feel like they don't want to move on, and they're by themselves, or no family support?
If one of the problems is no family support, then they should seek other support. They can seek support here on many of the shows that you have here. And,
I know I was going to say, let me just mention it before I forget it again. That's getting old due to you. But look, what I wanted to say was that this show, if even if people gave us topics to talk about, this is a show where it's free, where you know, if you was to go to mental health counseling, virtual or whatever, you know, you may have to pay. I don't know how that's set up,
Most of the
but
time it's free right now, actually. Um, it's also free right now. Insurances are fully covering for Medicare, Medicaid, for virtual health right now during the pandemic.
right. But
So
the
that's
point
good.
is they got to go through that process opposed to, you know, make an appointment where they don't
Yeah.
have to make an appointment here.
They just
You
come.
can come right here, maybe say something, ask a question that you may be going through. I mean, some people may be, you know, private about that, but just the topics, it, you know, may pertain to someone who's watching the show,
Oh,
and
yeah.
it may be able to help them whatever they may be dealing with. And again, before I just move on, let me just show this, is that, I mean, you know, we're just education, you know, this is for educational and informational purposes only, and it's not intended to apply to be substitute for professional help. But you can't get no other shows where you got two licensed social workers to help coach you through maybe a situation that a lot of people may be dealing with that may be common, such as anxiety and depression.
Mhm.
We're here for free.
Uh-huh. So how as I was saying, it says tackling suicidal thoughts. It's
Yeah.
not uncommon for people to have thoughts about harming or even killing themselves when they are depressed.
Yeah. Can I talk about that a little?
Sure, go ahead.
Okay, so here's the thing is there's two kinds of suicidal thoughts basically, and I do assessments like practically every day at my job for this. There's the passive suicidal thoughts where, man, you're just feeling so hopeless and so like feeling like I just want to go to sleep and not wake up in the morning. But you're thinking, I don't really want to hurt myself. I don't have any plans or intention. If you're thinking like that, you know, you can call for professional help, or you might want to just ask some questions on one of these shows here and, you know, try to gain support, or, you know, you can find valuable resources here at Urban Health, you know, somebody to talk to about why you're feeling that way if you're a renal patient, or even if you're not. But if you're really feeling like, man, I have a thought that I really want to hurt myself and I have a plan to go, like, you know, take all my medicine tonight and just be done with it. Whether you're a renal patient or not, you should definitely call the suicide hotline or go to your nearest ER to get professional help. Many states also have a hotline you can call separately. New Jersey's, the county I live in, Bergen, is 262-HELP, but you can find out what that is by calling even your social service agency or speaking to your social worker if you're on dialysis. But get help.
What are your thoughts, Sade, on that?
I totally agree. She's absolutely right. I mean, some people feel helpless and hopeless at certain points in their life. Not that they have like plans, means, intent to go through with it. It's just an emotion that they're feeling at that time. So sometimes people go there and you can help them get out of it. We're human. A lot of people have experienced it. A lot of people don't talk about it. They're scared. There's a fear of that they'll be judged for it. Certain events happen in your life that sometimes it feels like it's not going to get any better. So you just start to go off on a tangent. Like, maybe if I wasn't here, I wouldn't have to deal with this, because it can be too much. And then, like, on the other side, you have some people that actually have the plans, means, intent. They're about to do this. They ready to carry this thing out. They ready to get it over. And they still shouldn't be judged, but then that's where you got to do the more extreme measures to help them save their lives.
Well, Sade, let me ask you, how do you know when a patient is being open with you, and at what point is medication suggested?
You know, for me, I do a lot of intuitive work, discernment. Like, I'm good with that, following my gut and how I feel about certain things. So I let those things play into when I'm evaluating the patient's mental health status. You also pay attention to patients that you had for a while. Something might be off. it doesn't always look like it's the worst day of their life. Sometimes they might be too happy and it's different. So you kind of go with that as a clinician. You're trained in certain parts of it, but when some things are just innately in you and you can tell something's just not right. So you pay a little closer attention. When it comes to the medication part, I evaluate and I see where the person is. I see where they were. I look at the history. I look at the background. And I also look at the type of depression or anxiety that they have. And that's when I start to try to talk to them about medications. Sometimes I've had people that just needed to get over the hump. Like if you just like postpartum. A lot of people have postpartum. It's there. A lot of chemicals are off after you just given a baby. So most of the time they do well with maybe some short-term medication to get them over a hump. Like that's just what it is, and studies show that helps. Then you have people that may have chronic illness. They can't get out of the slump. It's something that's going to be there, and they're just not managing or faring well, and they're getting a little bit further to the edge. So you kind of talk to them about medication and how it can help the serotonin levels, some happy hormones, to just get things just a little, just help things kind of get imbalanced a little bit. And I tell people I'm not a medicine pusher. I don't push it, but I'm not against it either. So if I bring it up, I really think that you may be able to benefit from it.
What about you, Dawn? How do you
I
know when a person is being open with you, and when would you suggest medication regimen if necessary?
I'll answer the first one first.
Sure.
Like Sade, I have a very good gut feeling about whether they're being honest. I'm going to mention, because I'm human, my downfall is when they're addicts. It's sometimes hard to tell. So what I'll do there is often refer a lot of times for alcohol or drug addiction services, because if somebody's high or drunk, you can't really tell what they need other than right now not doing alcohol or drugs. Have to bring that up. But as far as other people, it's just a very careful assessment. Do they have a history of being on meds before? What are their symptoms like? I mean, I see people also who are hearing voices and, talking to themselves, and, are they a harm to themselves or others? Or is that potentially something they would have if they weren't on meds? How severe is their depression? Like Sade said, if somebody has postpartum, some people with postpartum need meds. Some women do not. I have a lady we're treating that just therapy after postpartum has really helped her greatly. It really depends on the situation. Now with the COVID virus and the politics, a lot of people right now, they don't really need medication, or they're just taking something temporarily, a very small dose of meds for anxiety or depression. But mostly what they really need is somebody to talk to, because they're shut in, they're lonely, they have no support. So again, it really just depends on each individual. And like I said, I have a pretty good gut after 13 years of a good feeling, and what is going on.
Yeah.
Wow, man, we're coming down to the end of the time, but before we go, Dawn, I just wanted you to, kind of put a plug in of the services that you do on social media. Any shout outs, and just any suggestions or word of encouragement for warriors that may be watching this right now and that could be dealing with some mental health issues.
First, if she's watching, I want to put a shout out to Jen Benson for about transplantjourneys.com. I'm actually going to be one of the advocates.
.org. I think it's .org.
.org, right? Yeah. And I'm going to be one of the advocates for one of the people that help on her website. So I'm going to
that's awesome! Congratulations.
Thanks. I'm really excited about that. So she's got somebody for me to mentor. So that's great. Checking out obviously the free education here. And like I said, anybody watching who might be from CBH Care, if you're not watching, then I'm going to be sending you this, a copy of this, for sure. And I want to say, you know, for people who are watching, it's okay. And I want to admit that I'm human. I've had those feelings too. When I first was diagnosed, I actually looked up to my dad's wife then that he had and said to her, "Look, you know what? I'd rather be dead than do dialysis." So you're not the only one that has felt that way, and it takes a lot for me to say that because everybody sees me as an extremely positive person, and I am. But you know, I've even had that feeling, even if it didn't last that long for me, due to the support system I had. It's normal to feel that way for a little bit until you figure out what is going on. It's normal to feel like that some days when you come off the machine. It's even normal when you first get the transplant meds, because some people get very depressed when they take home this package of medications that they don't understand. It's okay. Talk to me. You know, come on one of these shows and get educated. You know, talk to your social worker. Please talk to somebody. Find support. And you know, at Urban Health here, you can get a lot of education on you know, medications, help, support. If you're watching, shout out to Jonathan Trailer, because he's being a great advocate. He's making the rounds on shows with the guests on Urban Health as well.
Yeah, that's kind of crazy when you say making the rounds, because I mean, no, it's great, because 2 years ago I never seen anything like it. You know, multiple shows like this, or
it's great. It's wonderful.
You know, like shows with Jonathan or Nashonda, and it's good that other people are starting to do this to bring more awareness, and people could go on different shows. Again, everybody, I mean, has the deals with kidney disease, but each story is different.
Yeah, and that's why I went into social work, because I wanted to write a book. I wanted to write something about my story, and I wanted to add to it and say, I am a kidney disease. I'm a person with kidney disease. I'm a patient, but I'm also a human being who has other interests, which is so important, who has other career goals. And one of the reasons I wanted a transplant was to do something for other people once I had my transplant. So we're kidney warriors, we're patients, but we're people. We're so many other things. We're somebody's daughter, somebody's son, somebody's sister or brother. Maybe you're an artist or a cook. You know, find a passion, even if you're doing it, you know, a few minutes a day just to get your mind off being a patient. You're so much more than just a patient. You're a person with so many other great qualities. That's what I want to say to people.
Yeah.
Awesome. All right, Don, I want to let you go because I know you got a show in 30 minutes, co-host with Jared. But I just wanted to thank you for coming on tonight and adding to the discussion and sharing from your perspective, from a patient perspective, and from a social worker's perspective, licensed clinical social worker perspective.
Thanks.
And, yeah, I'm going to definitely bring you back because we're going to be doing the show in the future on relationships. I just gotta figure out how we're gonna do that.
Yes.
Yeah. Well, I've been married a long time too. So I've been married about 13 years also, and together with him about 15 years. So yeah. So most of my transplant, I've been married.
Wow, that'd be a great asset to the show. So, all right, Don, I'll see you at 8:30 with Jared A. Brown on Warriors Quest.
Nice to meet you, Sade.
Nice to meet you too, Don. Thank you.
All right.
Take care. Thanks again, Don. Bye-bye.
All right. Thanks.
So, Sade, I mean, this has been an awesome show. And again, I mean, with the pending lockdown looming, shows like this are going to probably be very, very important. And I'm sure you're going to probably even be more busier than, you know, what you are now.
Yes. It's really, really picking up. It's booming. Like, it's a lot going on, and I just wish more people would watch the show to know the importance of it. Even just the importance of talking about it. Like, mental health is so important. That is one of my mantras. I tell people, your mental health is just as important as your physical health. Sometimes your mental health can decline, and it can cause your physical health to decline, and vice versa. When your physical health decline, it can cause your mental health to to decline. So they both need to be treated simultaneously.
Wow. Wow. And so before we roll out, can you just share a little bit about your services and what you do outside of this show?
Yes. So, of course, you know, I am a licensed clinical social worker. I am the owner of My Empowering Impact, where we provide therapy services and coaching to people that are battling challenges or issues with mental health, depression, anxiety, grief, loss, postpartum, chronic illness, and the list goes on.
Right. Wow. Wow. Very straight to the point. Wow. So yeah, I mean, you're very valuable to this show. And again, I just want to thank you publicly for taking an hour out of your time each week to come on this show.
I thank you for having me. I think that you do an awesome job promoting this show and all of your shows, your network. I think that you are just doing a phenomenal job in the kidney world. I'm just so proud of you.
Thank you, Sade. I appreciate that. I mean, honestly, this is coming from the spirit or you know, God. But the thing is, the way I look at it, there's nothing, like no one else is doing it. And so it like comes to me like there's no mental health show or there's no show that's maybe talking about politics and kidney disease like Uncle Jim or Lisa Baxter or Warrior's Quest, a show that gives people hope and inspiration and a platform to search for a living donor. And you would think there would be shows out there like this with the technology, especially with kidney disease being the 9th leading cause of death in the United States. Everything I do, from going to clinic, and the post, to me, I feel like someone else should be doing it also, but it's not. I mean, and you're talking about the 9th leading cause of death. I mean, this is more than breast cancer and prostate cancer, not taking anything away from the cancers, but when you have a disease that is rated upon the, you know, top 10 leading causes of death, and the other ones are not, and they're getting more funding, something's just not right with that picture to me.
You know what? You bring a valuable point up, Steve. That's so true, especially when some of the diagnoses of kidney disease, not all of them, can be prevented. It makes you think like, why aren't you educating people to let them know that they shouldn't eat this food or so much of these things, or that diabetes could lead to this, or that even when they're diagnosed with different stages of kidney disease, if they change certain things, if it was related to diet, it could stop. But it seems like that education is not really there. Even for me, before I actually got into actually working in dialysis at that time, I'm telling you, Steve, I didn't even know it functioned like that. I knew that I had family that was on dialysis. I had close friends that dealt with it. They told me stories, but I had no idea it was a different world like that. So you're absolutely right. It's not anybody doing it, and it needs to be done.
I mean, it's just like you said, it's definitely a different world, just like the TV show, because I mean, it's so many dynamics. I mean, we can go on and on, but it's just so many dynamics, Sade, when it comes to dialysis, especially outpatient, because, and I'm not going to like get into a long drawn conversation, but just the fact, for instance, patients get diagnosed, they're in a hospital, they got the catheter, and you know, they got it, you know, they speak about, you got to hurry up and get the catheter out, infection. Get the catheter out, you know, they go for vein map and get to surgery, right? Mm-hmm. And then, you know, they thinking everything, they putting their trust in the process, and then they get to surgery and something goes wrong with their access. Mm-hmm. And then they got to get another access, or this access is not working, or I've seen patients with 4, 5, 6 accesses in both arms.
Oh my goodness.
Yeah. So my point is, it's a whole different world, because if a patient or a person is diagnosed, is not educated about a graft, a fistula, how to care for it, or maybe what to know when you go see the surgeon for the vein mapping, or especially for African Americans, we had Dr. Ted Singh from Fifth Assist Device, who made this device, the arm wellness, right? He invented this to put on your arm to inflate at your veins. It stays on the arm and it inflates at certain times. My point is, African Americans have small veins. He mentioned that on the show. Now, if he knows it and he's a vascular surgeon, I'm sure other vascular surgeons know it. And if they already know that, and a patient goes in there with diabetes and their veins are already small, and the surgeon knows that, and he still attempts to do access surgery, knowing that, that it may or may not develop, and then it don't develop, and you got to create another surgery. A lot of patients don't know about that.
You know what, Dad, we could probably talk about this for a long time because I have so much to add to that, but I'm just keep it short.
No, add a little bit.
That is so true. And like those type of things are sometimes money driven. Like they want to do a certain surgery that might allow them to pay more or something like that. Not that I know about that particular service, but a lot of the culture there is that they push to do things that they feel is beneficial. Not that it's the best for that client, that race or anything like that. It's what they feel is beneficial. Just like that reminds me of all of the pushing that they were doing about instant or hemodialysis. Matter of fact, I talked to Jim Benson about it when we had talked before. Like they pushed instant dialysis when studies had showed that peritoneal dialysis was better for a lot of people that still had kidney function. However, it wasn't until recently that the money went up for PD that they shifted their whole dynamic to push for PD. And it's like, you knew this study and this research years before, just like you saying they knew the research about the veins, but yet you still did what you wanted to do because you felt like it was beneficial. But when it's money or it's other stuff attached to it, all of a sudden it's like, oh, voila, we should do it this way. Y'all Ben should have did it that way. But they're so money hungry and driven by it. And it's not that they would go under if they didn't do the things. It's just greed. Like it's just it's awful.
Yeah, I mean, that's crazy. And speaking of that, we're going to close. Just like about 4 years ago, 3 to 4 years ago, my dad's doctor, they tried to convince him and myself, and I'm glad I'm a nurse, but they wanted him to get this thing called the Watchman window that you put in your heart, like a filter to prevent blood clots and all that. Man, I was like, my dad is, at the time, he was like 88 or something like that. I said, hell no, excuse my language, because I looked at the risk and everything involved, and he was 88. Now he's 90 years old. He haven't had any blood clots or whatever they said may happen or whatever. He's 90 years old. I mean, he has his issues, but he still walks around. He takes out the trash. I help, but I mean, he walks up the street. He cooks, cleans up. So, I mean, you're right. It's money driven.
That's why you got to get a doctor that you really trust. Like you have to, like I tell people, you have to shop around for a good doctor sometimes. Some doctors just don't take you seriously, or they don't treat you well or take care of you like they're supposed to do. So you have to be able to try to find somebody that you feel is good for you, not somebody just going to do anything that you ask for or just going to just say, oh, bro, this is what it is and that's it. Don't answer your questions. You need someone that's really going to take care of you, just like with mental health. You need someone that's going to do what they're supposed to do and not be just driven by the money to really take care of your health. Like if you know that this population does not fare well with this type of procedure, why would you offer it to me? Do you not care about my health?
Yeah,
Forget the money.
absolutely.
You know, it's just it's crazy and it's cruel.
It is, Sade. I mean, it is. And I mean,
Money hungry.
yeah, yeah. Um, yeah, I mean, we can go on, but I know it's another show coming up in about 20 minutes. I want to thank everyone. Watch the show, Jen Benson and Willa, Bridget,
Yes.
Jen Sign. Oh, you got a lot of
Thank you.
yeah, Jane.
Thanks.
I mean, Tom Kurkowski, Jonathan, Jared. I mean, Sade, and maybe you can help me. I know you've given me some great tips in the past, and I got to get those tips again. But I mean, all I want to do basically is educate this community that I feel that's not being done, in clinic, in center, because of the way treatment has shifted now. You have 3 shifts, literally 6 days a week at some places, 4 shifts, and there's not enough time to do any type of education such as mental health or going over your access or preparedness. What's that? Disaster preparedness, disaster. Mm-hmm. Any of that we used to do. Mm-hmm. So, thank you so much for coming on. But what can I do to increase that?
You know what? I think it's so hard to be able to penetrate the dialysis world sometimes, but I wish that some of the patients that are watching that are dialysis patients would spread the word to other patients that are in center, that they could just tune in to the show and watch and spread the word amongst your peers, because sometimes the population might be an older population. They're in a house. They want to watch things. They just don't know about you. They don't know about us. They don't know that we're here. Some of them don't know how to download the show that might want to watch it. So if they could just help them out to make them aware so they can be able to find you. If it's any liaisons left inside the clinics, patient care advocates that are there, spread the word, give them the links, let them know, set them up while you're in dialysis to teach them how to go to the show so they can
absolutely
right. Like, just spread the word because they all need it. Let them know what we're talking about, what we're doing. Just like you said, the Kidney Cookery, Warriors Quest, Mental Health and Me. There are so many shows that they can watch and comment on that they could be a part of our little family. That's going to be a big
right. And if they on YouTube, we got a YouTube channel.
Yes.
But yeah, Sade, that's really important because they can comment, and then if you see a comment, somebody may have a question, a mental health comment, you may see it, and you'll be able to comment on it, as a coaching.
And tell us what you want to hear about. Like, if you're struggling with different things or diagnosis or feelings, if you let us know, we can do a show about it. We can talk about it.
Yeah, and they can send it through Messenger.
Yes.
DM if you don't want to put it out there, and we'll get it, and we'll definitely do a show on it. So, all right, Sade, this has been an awesome show. Yes. Thank you, and I definitely will be reaching out to you during the week. I know you're busy. I try not to bother you as much as I used to, but I can see now you're really, really busy, man. And that's good. That's awesome.
Yes, I thank you. But we can make time, a little slot here and there, so we can touch base and things like that.
All right. That sounds good. All right, Sade, take it easy.
Bye-bye.
All right, bye-bye.
All
right. All right, guys. This has been a great show. I want to thank you for watching. Again, continue to share. This is for y'all guys. Seriously, I enjoy doing this because I know if I'm not going to do it, no one else will. Somebody got to step up and do this. And I accept that task wholeheartedly. And let me tell you, I did something today that, I don't know, it just came to me. I went to the Steve Harvey Show link on Facebook, that page. I went to Ellen's page. I went to D.L. Hughley, and I went to Ricky Smiley's page. And in the comment section, I put in the collage, and I just asked these guys to help spread the word. I threw in the collages, the 100 Warriors collage on all them guys' pages. I threw in the picture of DeVita and Family Dollar together. I'm serious about this. We got to get this out there, and we're going to create this community where warriors could come globally, like a global place that they can come and get information, whether it's Indonesia or Venezuela or the UK, Germany, wherever. So keep watching. We're going to come up with some great things. And I'd like to thank Louise Law, our partner from the UK. We have now set up the UK USA Education, Kidney Disease Education Connection. So I'd like to thank Louise Laws from the United Kingdom. Guys, become part of something bigger than you. Thank you guys for watching. Let me see these last two comments. Richard Knight, man, thank you for watching. I just want to say God bless you and the AAKP for recognizing me for that prestigious award, the Presidential Volunteer Service Award. Man, I mean, to be recognized with individuals such as yourself, Paul Conway, Dr. Raj, and Paul Conway, Dr. Raj, Edward Hickey, and there was another doctor, I got his name cut off, but thank you guys, I mean, so much for acknowledging me for this prestigious award. God bless you guys at the AAKP. Thanks, Jen. Sade, for watching. I saw Jen. Thank you, Jen, again. Guys, again, let's bridge that gap, that international gap of kidney disease education with AAKP leading the way, spearheading a global education powerhouse to educate warriors all across the United States. God bless you guys. Thank you for watching. Tune in 10 minutes for Jared A. Brown and Warriors Quest. And again, guys, I kid you not. I don't know when it's going to be. It could be a year, 2 years. It could be next month. I don't know. But be on the lookout for this. I kid you not. This is what God told me. But be on the lookout. I just don't know when it's going to happen. But just be on the lookout. And when it do happen, we're going to come to a town near you. Peace and God bless.